How does it feel for me? Emma and Adam's update, January 2022, Part 2. What worked well about your perinatal appointment?
I actually preferred that it moved to Zoom if it was going to be in Armley, the perinatal appointment, because that would have been a difficult place for me to get to. I would have had to rely on maybe one of my parents taking me there because I wouldn't have been able to do it on public transport myself. So switching to Zoom actually worked out okay in the end for me. The doctor that I met, was really nice, but I had to go right kind of from the start of all my difficulties and do like timeline and go through everything, which was quite hard. And I think I would have thought that Harrogate might have sent a lot of stuff through, but apparently they had nothing from Harrogate or she didn't have access to it. But I wonder if they always want to hear it from you anyway, because in our experience, notes aren't always accurate, and it actually felt a bit better that she was actually asking it for it from my point of view, to be honest. But yeah, maybe it would have been nicer to have known that I would have had to have gone through that, because then I could have prepared it a bit better as well, because the appointment was supposed to be 90 minutes and she stayed with me for over 2 hours. So she did stay longer in order to get it done, but it would have probably been a better use of both our time had I known about it. She mostly wanted to speak to me, but then she thought it'd be good to have Adam in as well. So it felt like she cared about listening to both of us. So now I'm not under them, I'm just known to them now, so I can be referred back when needed. So it was nice that even though she said I no longer needed any more input from them for now, you can still talk to us. So that was nice. Yeah.
Did you feel listened to?
Well, in the appointment, and it turned out that our preference of me staying on medicines was their same recommendation. So it felt we were on the same page, and it wasn't just medicines are bad for the baby, don't be on your medicines. It felt like it was really taking into consideration your history and where you're currently at and any concerns. So it felt like we're on the same page with that. So that felt nice.
Did you get information in a way you understood?
I got letters both times, but I got phone calls to say that it had to be rescheduled, and then I got phone calls again to say when it was being rescheduled and what I then had to do. When they first rang the first ever time, I thought it was like a telesales person. They didn't say what service they were with and just said, "Is that Emma?" And then said, "We'd like to ask you some questions." And I nearly put the phone down going like, "Sorry, I don't want to do this." And I can't remember what they said, but it still wasn't to say who they were or anything, but it didn't sound like a legitimate NHS service. So I was really confused by that. And even after I put the phone on, I didn't know what I just answered questions for. So that was really confusing. But all future contact did mention their name and stuff, but that really confused me.
Was Adam involved in the appointment when you wanted him to be?
At the very start of the appointment, she said, "Would you like your husband," and now husband, got married, husband now in the appointment? And then I said, "He's actually at work, but he's in the next room, so he can pop in." She goes, "Oh, if you're happy to, then we'll do the bit where I have to get all the information and your history. We can do as much of that as we can on just with us two, and then we can ask him to come through." I think he definitely would have been allowed to be there the whole time if I wanted him to be, or if we were able to.
One of my big questions outside around the medication and keeping you well in that scenario was about kind of the way that the service worked, because it, as you know, we're under Harrogate's mental health team, but only for inpatient and community, but everything else is in Leeds. So
Perinatals in Leeds.
Perinatals in Leeds. So it's about they don't have access to Emma's records, and it's about how do we make sure the care is joined up. So if Emma was struggling, if she was pregnant, or in terms of any sort of maternity-based stuff, there's like the care is joined up, that she gets help that she needs, and it's not detached, I suppose.
In the appointment, they said it's more about you've got to plan that now within your team. Yeah. What would happen? It's not us then, but we'd get back involved if and when you become pregnant.
Did it feel joined up?
If you have to be across boundaries for services in wherever you get them, especially something like this, it feels like they need to be able to access your notes. The leads won't know what you've been doing with Harrogate at any point. You might have been for an appointment for a month or so, and loads of stuff might have happened, and then you go to Leeds, and it's kind of like either remembering to recount it all, or it might be something that's related to the baby or pregnancy, and it's like, well, how are they going to know that if they don't? It's just, yeah, it's quite important, isn't it?
If you could have changed one thing to make your experience better this month, what would it be?
For the perinatal, one thing I would change would be knowing that I'd have had to have gone through my kind of timeline of history, so I could have planned that and had been ready for that a bit more, and not felt like I was making the appointment, having to stay so long for the appointment to get it covered. I felt guilty for that.
For the perinatal one,
be more proactive about offering the Zoom.
Yeah, proactive about in offering Zoom rather than saying you have to make it to Armley.
And then finding out it was Zoom because of COVID.
Yeah. So it's like, well, the ability's there, so I think have that as an option going forward. If they can do it on Zoom, which we had to do, and like say, considering the location and how hard that would have been for you to get to, there wasn't an option to how you could attend that appointment, given that both could have worked.